Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Phase 3 trial of Crinecerfont in adult congenital adrenal hyperplasia. Background. Adrenal insufficiency in patients with classic 21-hydroxylase deficiency congenital adrenal hyperplasia, CAH, is treated with glucocorticoid replacement therapy. Control of adrenal-derived androgen excess usually requires supraphysiologic glucocorticoid dosing, which predisposes patients to glucocorticoid-related complications. Crinecerfont, an oral corticotropin, releasing factor type 1 receptor antagonist, lowered androstenedione levels in Phase 2 trials involving patients with CAH. Methods. In this Phase 3 trial, we randomly assigned adults with CAA in a 2-to-1 ratio to receive Crinecerfont or placebo for 24 weeks. Glucocorticoid treatment was maintained at a stable level for 4 weeks to evaluate androstenedione values, followed by glucocorticoid dose reduction and optimization over 20 weeks to achieve the lowest glucocorticoid dose that maintained androstenedione control, less than or equal to 120% of the baseline value, or within the reference range. The primary efficacy endpoint was the percent change in the daily glucocorticoid dose from baseline to week 24, with maintenance of androstenedione control. Results. All 182 patients who underwent randomization, 122 to the Crinecerfont group and 60 to the placebo group, were included in the 24-week analysis, with imputation of missing values. 176 patients, 97%, remained in the trial at week 24. The mean glucocorticoid dose at baseline was 17.6 mg per square meter of body surface area. Per day of hydrocortisone equivalents, the mean androstenedione level was elevated at 620 nanograms per deciliter. At week 24, the change in the glucocorticoid dose, with androstenedione control, was minus 27.3% in the Crinecerfont group and minus 10.3% in the placebo group. Least squares mean difference, minus 17.0 percentage points, p less than 0.001. A physiologic glucocorticoid dose, with androstenedione control, was reported in 63% of the patients in the Crinecerfont group and in 18% in the placebo group, p less than 0.001. At week 4, androstenedione levels decreased with Crinecerfont, minus 299 nanograms per deciliter, but increased with placebo, 45.5 nanograms per deciliter. Least squares mean difference, minus 345 nanograms per deciliter, p less than 0.001. Fatigue and headache were the most common adverse events in the 2 trial groups. Conclusions. Among patients with CAA, the use of Crinecerfont resulted in a greater decrease from baseline in the mean daily glucocorticoid dose, including a reduction to the physiologic range, than placebo following evaluation of adrenal androgen levels. Post-acute sequelae of SARS-CoV-2 infection in the pre-Delta, Delta, and Omicron eras. Background. Post-acute sequelae of severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, infection, PASC, can affect many organ systems. However, temporal changes during the coronavirus disease 2019, COVID-19, pandemic, including the evolution of SARS-CoV-2, may have affected the risk and burden of PASC. Whether the risk and burden of PASC have changed over the course of the pandemic is unclear. Methods. We used health records of the Department of Veterans Affairs to build a study population of 441,583 veterans with SARS-CoV-2 infection between March 1, 2020, and January 31, 2022, and 4,748,504 non-infected contemporaneous controls. We estimated the cumulative incidence of PASC at 1 year after SARS-CoV-2 infection during the pre-Delta, Delta, and Omicron eras of the COVID-19 pandemic. Conclusions. The cumulative incidence of PASC during the first year after SARS-CoV-2 infection decreased over the course of the pandemic, but the risk of PASC remained substantial even among vaccinated persons who had SARS-CoV-2 infection in the Omicron era. Next, we will be discussing articles from Journal of American Medical Association. A vaping cessation text message program for adolescent e-cigarette users. A randomized clinical trial. Is a tailored, interactive text message program for vaping cessation effective in promoting abstinence from e-cigarettes among adolescents? Findings. A two-group randomized clinical trial was conducted with 1,503 adolescent e-cigarette users, with 70.8% retention at 7 months. In intention to treat analysis, with missingness coded as vaping, abstinence rates were 37.8% among participants assigned to the text message intervention and 28.0% among participants assigned to assessment-only control, a statistically significant difference. No baseline characteristics moderated the treatment outcome relationship, including nicotine dependence, meaning a tailored, interactive text message program increased self-reported vaping cessation rates among adolescents recruited via social media channels. Next, we will be discussing the annual cost of cancer screening in the United States. Background. Cancer has substantial health, quality of life, and economic impacts. Screening may decrease cancer mortality and treatment costs, but the cost of screening in the United States is unknown. Objective. To estimate the annual cost of initial cancer screening, that is, screening without follow-up costs, in the United States in 2021. Results. Total healthcare system costs for initial cancer screenings in the United States in 2021 were estimated at $43 billion. Approximately 88.3% of costs were attributable to private insurance, 8.5% to Medicare, and 3.2% to Medicaid, other government programs, and uninsured persons. Screening for colorectal cancer represented approximately 64% of the total cost. Screening colonoscopy represented about 55% of the total. Facility costs, amounts paid to facilities where testing occurred, were major drivers of the total estimated costs of screening. Next, we will be discussing articles from British Medical Journal. Intake of sugar-sweetened beverages among children and adolescents in 185 countries between 1990 and 2018. Population-based study objective to quantify global intakes of sugar-sweetened beverages, SSBs, and trends over time among children and adolescents. Results. In 2018, mean global SSB intake was 3.6, standardized serving equals 248 grams, 8 ounces. Servings/week, 1.3, 95% uncertainly interval 1.0 to 1.9. In South Asia to 9.1, 8.3 to 10.1, in Latin America and the Caribbean. SSB intakes were higher in older versus younger children and adolescents, those resident in urban versus rural areas, and those of parents with higher versus lower education. Between 1990 and 2018, mean global SSB intakes increased by 0.68 servings/week, 22.9%, with the largest increases in sub-Saharan Africa, 2.17 servings/week, 106%. Of 185 countries included in the analysis, 56, 30.3%, had a mean SSB intake of greater than or equal to 7 servings/week, representing 238 million children and adolescents, or 10.4% of the global population of young people. Conclusion. This study found that intakes of SSBs among children and adolescents, aged 3 to 19 years in 185 countries, increased by 23% from 1990 to 2018, parallel to the rise in prevalence of obesity among this population globally. SSB intakes showed large heterogeneity among children and adolescents worldwide, and by age, parental level of education, and urbanicity. Next, we will be discussing articles from Lancet. Molecularly guided therapy versus chemotherapy after disease control in unfavourable cancer of unknown primary. CUPISCO, an open-label, randomized, Phase 2 study. Background. Patients with unfavourable subset cancer of unknown primary, CUP, have a poor prognosis when treated with standard platinum-based chemotherapy. Whether first-line treatment guided by comprehensive genomic profiling, CGP, can improve outcomes is unknown. The CUPISCO trial was designed to inform a molecularly time-guided treatment strategy to improve outcomes over standard platinum-based chemotherapy in patients with newly diagnosed, unfavourable, non-squamous CUP. The aim of the trial was to compare the efficacy and safety of molecularly guided therapy, MGT, versus standard platinum-based chemotherapy in these patients. This was to determine whether the inclusion of CGP in the initial diagnostic workup leads to improved outcomes over the current standard of care. We herein report the primary analysis. Interpretation. In patients with previously untreated, unfavourable, non-squamous CUP who reached disease control after induction chemotherapy, CGP, with subsequent MGTs, resulted in longer progression-free survival than standard platinum-based chemotherapy. On the basis of these results, we recommend that CGP is performed at initial diagnosis in patients with unfavourable CUP. Next, we will be discussing articles in the field of Hemato Oncology. Here are the articles from Cancer Journal for clinicians. Cancer diagnosis and treatment in working-age adults, implications for employment, health insurance coverage, and financial hardship in the United States. The rising costs of cancer care and subsequent medical financial hardship for cancer survivors and families are well documented in the United States. Less attention has been paid to employment disruptions and loss of household income after a cancer diagnosis and during treatment, potentially resulting in lasting financial hardship, particularly for working-age adults not yet age-eligible for Medicare coverage and their families. In this article, the authors use a composite patient case to illustrate the adverse consequences of cancer diagnosis and treatment for employment, health insurance coverage, household income, and other aspects of financial hardship. They summarize existing research and provide nationally representative estimates of multiple aspects of financial hardship and health insurance coverage, benefit design, and employee benefits, such as paid sick leave, among working-age adults with a history of cancer, and compare them with estimates among working-age adults without a history of cancer from the most recently available years of the National Health Interview Survey, 2019 to 2021. Then, the authors identify opportunities for addressing employment and health insurance coverage challenges at multiple levels, including federal, state, and local policies, employers, cancer care delivery organizations, and nonprofit organizations. These efforts, when informed by research to identify best practices, can potentially help mitigate the financial hardship associated with cancer. Here are the articles from Journal of Clinical Oncology. LAC trial. Final analysis on overall survival comparing open versus minimally invasive radical hysterectomy for early-stage cervical cancer. Clinical trials frequently include multiple endpoints that mature at different times. The initial report, typically based on the primary endpoint, may be published when key planned co-primary or secondary analyses are not yet available. Clinical trial updates provide an opportunity to disseminate additional results from studies published in JCO or elsewhere, for which the primary endpoint has already been reported. The aim of this study was to compare overall survival between open and minimally invasive radical hysterectomy, with participants followed for 4.5 years. The primary objective was to evaluate whether minimally invasive surgery was non-inferior in disease-free survival, DFS, to abdominal radical hysterectomy. Secondary outcomes included overall survival. Sample size was based on DFS of 90% at 4.5 years and 7.2% non-inferiority margin for minimally invasive surgery. A total of 631 patients were enrolled, 319 assigned to minimally invasive, and 312 to open surgery. Of these, 289, 90.6%, patients underwent minimally invasive surgery, and 274, 87.8%, patients open surgery. At 4.5 years, DFS was 85.0% in the minimally invasive group and 96% in the open group. Difference of -11.1, 95% CI, -15.8 to -6.3. P equals 0.95 for non-inferiority. Minimally invasive surgery was associated with lower rate of DFS compared with open surgery. Hazard ratio, HR, 3.91, 95% CI, 2.02 to 7.58, P less than 0.001. Rate of overall survival at 4.5 years was 90.6% versus 96.2% for the minimally invasive and open surgery groups, respectively. HR for death of any cause equals 2.71, 95% CI, 1.32 to 5.59, P equals 0.007. Given higher recurrence rate and worse overall survival with minimally invasive surgery, an open approach should be standard of care. Here are the articles. From Journal of Hepatology, Prospective Head-to-Head Comparison of Non-Invasive Scores for Diagnosis of Fibrotic MASH in Patients with Type 2 Diabetes. Patients with Type 2 Diabetes and Fibrotic MASH, NOS greater than or equal to 4, and F greater than or equal to 2, are the most at risk of developing liver-related outcomes. They may also benefit from pharmacologic treatments when they are available. We performed a head-to-head comparison of FAST, MAST, MAFib, and FNI scores for identifying fibrotic MASH. FAST and MAST scores outperformed MAFib and FNI in patients with type 2 diabetes and MOSLD. Next article. Multicenter Phase 2 trial of cabozantinib in patients with hepatocellular carcinoma after immune checkpoint inhibitor treatment. This Phase 2 clinical trial evaluated the use of cabozantinib after prior use of immunotherapy regimens in hepatocellular carcinoma. The median progression-free and overall survival associated with cabozantinib were 4.1 and 9.9 months, respectively. When used as second-line therapy, the median and progression-free and overall survival were 4.3 and 14.3 months, respectively. In multivariable analyses, prior number of treatment lines, 1 versus 2, was an independent prognosticator for overall survival. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Risk of esophageal adenocarcinoma after Helicobacter pylori eradication treatment in a population-based multinational cohort study. Background and aims. Helicobacter pylori infection is associated with a decreased risk of esophageal adenocarcinoma, and the decreasing prevalence of such infection might contribute to the increasing incidence of this tumor. We examined the hypothesis that eradication treatment of H. pylori increases the risk of esophageal adenocarcinoma. Results. Among 661,987 participants, who contributed 5,495,552 person-years after eradication treatment. Median follow-up, 7.8 years. Range, 1 to 24 years. 550 cases of esophageal adenocarcinoma developed. The overall SIR of esophageal adenocarcinoma was not increased. SIR equals 0.89, 95% CI, 0.82 to 0.97. The SIR did not increase over time after eradication treatment, but rather decreased, and was 0.73, 95% CI, 0.61 to 0.86, at 11 to 24 years after treatment. There were no major differences in the stratified analyses. The overall SIR of esophageal squamous cell carcinoma, calculated for comparison, showed no association. SIR equals 0.99, 95% CI, 0.89 to 1.11. Conclusions. This absence on an increased risk of esophageal adenocarcinoma after eradication treatment of H. pylori suggests eradication is safe from a cancer perspective. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Low-risk Staphylococcus aureus bacteremia patients do not require routine diagnostic imaging, a multi-center, retrospective, cohort study. Background. Stratification to categorize patients with Staphylococcus aureus bacteremia, SAB, as low or high risk for metastatic infection may direct diagnostic evaluation and enable personalized management. We investigated the frequency of metastatic infections in low-risk SAB patients, their clinical relevance, and whether omission of routine imaging is associated with worse outcomes. Methods. We performed a retrospective cohort study at 7 Dutch hospitals among adult patients with low-risk SAB, defined as hospital-acquired infection without treatment delay, absence of prosthetic material, short duration of bacteremia, and rapid defervescence. Primary outcome was the proportion of patients whose treatment plan changed due to detected metastatic infections, as evaluated by both actual therapy administered and by linking adjudicated diagnosis to guideline-recommended treatment. Secondary outcomes were 90-day relapse-free survival and factors associated with the performance of diagnostic imaging. Results. Of 377 patients included, 298, 79%, underwent diagnostic imaging. In 15 of these 298 patients, 5.0%, imaging findings during patient admission had been interpreted as metastatic infections that should extend treatment. Using the final adjudicated diagnosis, 4 patients, 1.3%, had clinically relevant metastatic infection. In a multi-level, multivariable logistic regression analysis, 90-day relapse-free survival was similar between patients without imaging and those who underwent imaging, 81.0% versus 83.6%, adjusted odds ratio, 0.749, 95% confidence interval, 0.373 to 1.504. Conclusions. Our study advocates risk stratification for the management of SAB patients. Prerequisites are follow-up blood cultures, bedside infectious diseases consultation, and a critical review of disease evolution. Using this approach, routine imaging could be omitted in low-risk patients. Next, we will be discussing articles in the field of rheumatology. Here are the articles from Arthritis and Rheumatology. Features of axial spondyloarthritis in 2 multicenter cohorts of patients with psoriasis, uveitis, and colitis presenting with undiagnosed back pain. Objective. We aimed to assess 1. The frequency of axial spondyloarthritis, AX-SPA, according to extra-articular presentation and HLA-B27 status. 2. Clinical and imaging features that distinguish AX-CA from non-AX-SPA. 3. The impact of MRI on diagnosis and classification of AX-CA. Conclusions. Optimal management of patients presenting with PSO, A.I.O, IBD, and undiagnosed chronic back pain should include referral to a rheumatologist. Conducting MRI in all patients enhances diagnostic accuracy. Here are the articles from Journal of Clinical Rheumatology. Rheumatoid arthritis-related lung disease and its association with mortality. Purpose. The aim of this study was to determine the association of rheumatoid arthritis-related lung disease, RALD, and its subtypes with all-cause mortality. Materials and methods. For the present analyses, patients with RA who underwent computed tomography of the chest CT, were evaluated. RALD was defined in 4 subtypes as follows: interstitial lung disease, RA-ILD, airway disease, RA-AD, rheumatoid pulmonary nodules, RAPN, and RA-related pleural disease, RAPD. The date of RALD diagnosis was considered the date of the first chest CT detecting the pathology. Conclusions. In this study, RAAD was the most common subtype, and the presence of RALD increased mortality. This effect was particularly pronounced in patients with RA-ILD and RAPD, or those presenting with 2+ subtypes. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Vigorous exercise in patients with congenital long QT syndrome. Results of the prospective, observational, multinational live LQTS study. Background. Whether vigorous exercise increases risk of ventricular arrhythmias for individuals diagnosed and treated for congenital long QT syndrome, LQTS, remains unknown. Conclusions. Among individuals diagnosed with phenotypic and/or genotypic LQTS, who were risk-assessed and treated in experienced centers, LQTS-associated cardiac event rates were low and similar between those exercising vigorously and those not exercising vigorously. Consistent with the low event rate, Cs are wide, and non-inferiority was not demonstrated. These data further inform shared decision-making discussions between patient and physician about exercise and competitive sports participation. Here are the articles from journals of the American College of Cardiology. Prescription patterns for sodium glucose cotransporter 2 inhibitors in U.S. health systems. Background. Sodium glucose cotransporter 2, SGLT2, inhibitors reduce heart failure, HF, hospitalizations, recurrent cardiovascular events, and chronic kidney disease, CKD, progression, and thus constitute a Class 1A recommendation in people with diabetes and atherosclerotic cardiovascular disease, HF, or CKD, and in people with severe albuminuria, or HF, regardless of diabetes status. Objectives. The purpose of this study was to comprehensively characterize the rate of TAM, SGLT2 inhibitor prescriptions among people with a Class 1A recommendation for SGLT2 inhibitor use. Conclusions. In this analysis of U.S. data from 2022 to 2023, SGLT2 inhibitor prescription among people with a Class 1A recommendation is low. Interventions are needed to increase uptake of guideline-recommended SGLT2 inhibitor use. From JAMA Cardiology, Emergency Medical Service Agency Practices, and Cardiac Arrest Survival. Question: which emergency medical services, EMS, agency practices, are associated with favorable neurological survival for out-of-hospital cardiac arrest, OHCA? Findings. This cohort study among 470 EMS agencies in the Cardiac Arrest Registry to Enhance Survival, CARES, for OCA identified 7 practices related to training, cardiopulmonary resuscitation, and transport that were associated with favorable neurological survival. Adoption of more than half, greater than or equal to 4, of these practices was more common at EMS agencies in the highest quartile of favorable neurological survival versus agencies in the lowest quartile, 59.3% versus 35.6% respectively, meaning given wide variability in EMS agency rates for OCA survival, these findings provide initial insights into EMS practices associated with top-performing EMS agencies. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Treatment satisfaction with Omnipod- in adults with type 1 diabetes, a non-blinded 1-to-1 randomized controlled trial. Objective. We compared treatment satisfaction with Omnipod- system to usual care, multiple daily injections, MDIs, or tubed IPT, in adults with type 1 diabetes using self-monitoring blood glucose, SMBG, methods. Adults with type 1 diabetes on MDI, N equals 40, or IPT, N equals 25, from 4 diabetes centers in Australia, were randomly assigned in a 1-to-1 non-blinded manner to Omnipod- system, Omnipod group, or continue usual care group, for 12 weeks, followed by a further 12-week extension, during which all participants used the device. Conclusion. The Omnipod- system resulted in greater treatment satisfaction at 12 weeks in adults with type 1 diabetes using SMBG that was sustained after 24 weeks of device use without compromising sleep quality and fear of hypoglycemia. Improvements in glycemia were also observed. Embark, a randomized, controlled trial comparing 3 approaches to reducing diabetes distress and improving HbA1c in adults with type 1 diabetes. Objective: to compare the effectiveness of 3 interventions to reduce diabetes distress, DD, and improve HbA1c among adults with type 1 diabetes, T1D. Research design and methods. Individuals with T1D, N equals 276. With elevated DD, a score greater than 2 on the total type 1 diabetes distress scale, and HbA1c, greater than 7.5%, were recruited from multiple settings and randomly assigned to one of 3 virtual group-based programs. 1. Streamline, an educator-led education and diabetes self-management program. 2. Tuned In, a psychologist-led program focused exclusively on emotional-focused DD reduction. Or 3. Fix It, an integration of Streamline and Tuned In. Assessments of the primary outcomes of DD and THbA1c occurred at baseline and at 3, 6, and 12 months. Conclusions. DD. B successfully reduced among individuals with T1D with elevated HbA1c using both the educational/behavioral and emotion-focused approaches included in the study. Although both approaches are associated with significant and clinically meaningful reductions in DD and TbA1c, Tuned In, the emotion-focused program, had the most consistent benefits across both DD and THbA1c. The study findings suggest the overall value of group-based, fully virtual, and time-limited emotion-focused strategies, like those used in Tuned In, for adults with T1D. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. MRI-derived modeling of disease progression patterns in patients with temporal lobe epilepsy. Background and objectives. Temporal lobe epilepsy, TLE, is assumed to follow a steady course that is similar across patients. To date, phenotypic and temporal diversities of TLE evolution remain unknown. In this study, we aimed at simultaneously characterizing these sources of variability based on cross-sectional data. Discussion. Cross-sectional MRI-derived models provide reliable prognostic markers of TLE disease evolution, which follows distinct trajectories, each associated with divergent patterns of hippocampal and whole brain structural alterations, as well as cognitive and clinical profiles. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Effect of azithromycin on asthma remission in adults with persistent uncontrolled asthma. Background. Asthma remission is a potential treatment goal. Research question. Does adding azithromycin to standard therapy in patients with persistent uncontrolled asthma induce remission compared with placebo? Results. A total of 335 participants, 41.5% male, median age, 61.01 years, quartile 1 to 3, 51.03 to 68.73, who completed the 12-month treatment period were included in the analysis. 12 months of treatment with azithromycin induced asthma remission in a subgroup of patients, and a significantly higher proportion in the azithromycin arm achieved both clinical remission, 50.6% versus 38.9%, p equals 0.032, and clinical remission plus lung function criteria, 50.8% versus 37.1%, p equals 0.029, compared with placebo, respectively. In addition, a higher proportion of the azithromycin group achieved complete remission, 23% versus 13.7%, p equals 0.058. Sensitivity analyses supported these findings. Baseline factors, e.g., better asthma-related quality of life, absence of oral corticosteroid burst in the previous year, predicted the odds of achieving clinical remission. azithromycin-induced remission in both eosinophilic and non-eosinophilic asthma. Interpretation. In this study, adults with persistent symptomatic asthma achieved a higher remission rate when treated with azithromycin. Remission on treatment may be an achievable treatment target in moderate/severe asthma, and future studies should consider remission as an outcome measure. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Accelerated lung function decline and mucus microbe evolution in chronic obstructive pulmonary disease. Rationale: progressive lung function loss is recognized in chronic obstructive pulmonary disease, COPD. However, no study concurrently evaluates how accelerated lung function decline relates to mucus properties and the microbiome in COPD. Methods. This was a prospective, longitudinal assessment of the London COPD cohort, exhibiting the greatest FEV1 decline, N equals 30, accelerated decline, 156 mmol/IR FEV1 loss, and with no FEV1 decline, N equals 28, non-decline, 49 mmol/IR FEV1 gain, over time. Lung microbiomes from paired sputum, total 116 specimens, were assessed by shotgun metagenomics, and corresponding mucus profiles, evaluated for biochemical and biophysical properties. Conclusions. Mucus microbiome associations evolve over time with accelerated lung function decline, symptom progression, and exacerbations, affording fresh therapeutic opportunities for early intervention. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Validation of non-invasive detection of hyperkalemia by artificial intelligence, enhanced electrocardiography in high acuity settings. Key points. Measuring blood potassium has always required access to blood. The surface electrocardiogram, analyzed using an artificial intelligence algorithm, can detect hyperkalemia bloodlessly. The artificial intelligence analyzed electrocardiogram exhibited a high negative predictive value, but substantially lower positive predictive value. A national survey of pregnancy and parenthood among nephrology trainees, a focus on nephrology fellowship. Parental leave policies for physician trainees are inconsistent. Nephrology fellows are largely unaware of parental leave policies and pregnancy accommodations in their programs. Individual nephrology programs should improve awareness about national and local program policies among trainees. Here are the articles from Kidney International Reports. Obinutuzumab, as initial or second-line therapy in patients with primary membranous nephropathy. Introduction. B-cell lymphocytes have been demonstrated to play a key role in the pathogenesis underlying membranous nephropathy, MN. The aim of this study was to evaluate the therapeutic efficacy and safety of obinutuzumab, a glycoengineered type 2 anti-CD20 monoclonal antibody in individuals with MN. Methods. We retrospectively analyzed data from 59 consecutive patients with primary MN who provided consent to receive obinutuzumab and were followed for at least 6 months. The primary outcomes were complete proteinuria less than 0.3 grams/d, or partial proteinuria less than 3.5 grams/d, with greater than or equal to 50% reduction, remission of proteinuria. Conclusion. Obinutuzumab may represent a promising and well-tolerated therapeutic option for individuals with primary MN. The potential of obinutuzumab was highlighted as an initial therapy for primary MN.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.